knowledge is power.
Hi, I laughed at the comments and beautiful creator. This video is not about this particular creator, but if you have PCOS and you want to have children, this advice may not be for you. And let me tell you why this advice may not be for you. If you have PCOS and you get married and by some sort of chance you are able to get pregnant immediately you get married, my darling sister, you see that window of fertility? Don't let it close. Born all your children in that window of fertility that you are seeing, because people who have PCOS, your window of fertility is not very large, and when you're in your 20s, it is easier than when you get into your 30s. So recently, for those of us based in Nigeria, there's a woman that has been trending, Nancy Ume, and she just had a baby with surrogacy, and she came out and shared her story how she had 2 children even though she had PCOS initially, and by the time she wanted to start trying for her 3rd baby, it wasn't that window was not there again, and she couldn't conceive naturally, so she had to make use of assisted reproduction with surrogacy. So I saw another woman on Facebook who shared her own similar story, and she also had PCOS, and she said before she got married, someone, her mom or somebody or something, they advised her that this PCOS thing, if there's a window of fertility, or her doctor who was at the time trying to have children, if there's a window of fertility, take advantage of that window. So according to her, she had to force herself and had her babies back to back because she had PCOS. And ask me why I'm telling you this story, because me, when I had my son in my 20s, before I had my son, I had PCOS, okay? And it took 4 years before I conceived. And they warned me, they were telling me, they were like, once your body is open and you start having children, do it fast. But at that time I was working, so I was like, no, I want to wait 2 years. So as soon as I took in for my son, my medical provider, some other people, my mom, everybody, they kept telling me, this is the best time to take in again. Don't waste time, because we're like 2 months. I should try and start again, because that window where it's not easy. I wish I listened to them, okay, because the struggle to conceive after that is not here, and you don't want to go through that. It's not something that anybody prays to go through. So when I listened to the woman on Facebook who was talking about the fact that she had PCOS and she was advised that window of fertility, once you're born one, if you don't have PCOS, this does not apply to you. But if you know you have PCOS, you've done the scan, and by any means you get that window of fertility, if you don't want to suffer, if you don't want to cry, it's not easy. Once you give birth, try. If you want to have children, not everybody wants to have children, but if you want to have children, once that window opens, born all your children. Just try, because I think the woman is Ghanaian, and she said that as soon as she had her baby, her first baby, it wasn't easy getting the mood of, you're still trying to nurse your first baby. Like, people criticized her because it's not everybody will come and sit down and be explaining, oh, this is what I have, this is what I'm going through. But she had to take that sacrifice to have all her children. So please, some people, it's very easy for them to conceive. It's not an issue. But I don't know why PCOS is on the rise now. A lot of people have fertility issues. So if you fall in that category and you fall in that, don't try yourself. Like, it's hard, but if you know you want to have children and you're in your 20s, or you get pregnant by any, don't waste time, because going back to what the woman said, because when Nancy was sharing her story about they had to use surrogates, the surrogate to have their baby, people were criticizing her like, oh, you've had 2 children before, why, what do you mean that you cannot conceive again? It's not straightforward like that, because when I just understood when the woman, she's a Ghanaian woman on Facebook, if I remember her name, I'll do a video. When she was talking about it, I was like, this is what they were telling me, and I did not pay attention. I was feeling I'm young, because people just tell you, oh, you're young. Nah, if you have PCOS, don't listen to that you are young. Or if you have PCOS, try. Anyhow you want to try when you are in your 20s to conceive and have all your children, because by the time you get into your 30s, it is a different ball game. It is a different ball game. You don't want to be in that situation, I promise you. Some of us can come, we can laugh, we're able to, our emotional capacity is high. You don't want to go through that experience, okay? My love to the creator, this is not a shade to her, but I'm just talking to you. If you know you have PCOS and that anyhow you're able to get pregnant, that pregnant time, don't waste it, because that window of fertility, it takes the grace of God. Do you understand? It takes the grace of God for that window to open. And the trauma, if you don't know Nancy, please go and watch her. Her journey has really been inspiring a lot of people. So the trauma of trying to conceive in your 30s, see, I don't wish it for my enemy, okay? I don't wish it for my enemy. I don't wish it for anybody. So I'm saying all of this to say that, please, again, if you have PCOS, you're in your 20s or you're in your 30s, somehow you took in that window, see, prop up your mind. It's a sacrifice you have to make, okay? Because it is better to go through that sacrifice after you just had a baby to conceive again, all right, than the waka you will waka if that window of fertility closes. And you know that for we women, we have a biological clock. Men, they can keep having children in their 50s, in their 60s. But you as a woman, you see that your 20s, don't waste it to try. When they used to say those things in those days, we used to be like, what are they talking about? Blah, 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 blah. Try. If you have the opportunity, okay, to have your children in your 20s, it's easier. Your body is easy. Like, it's way easier. In your 30s, see, that energy you used to have in your 20s, it's not there. You understand? It's not there. It's not like you don't want to be there, I promise you. Okay? So the sacrifice you would make having back-to-back babies in your 20s or wherever, when you are able to have with PCOS, I'm specific on what I'm talking about, PCOS, is better than when you are going from different places, different doctor to doctor, trying to have babies. Okay, love you. Bye. I forgot to introduce myself. I'm Topisco. Okay, I'm trying to find my way on TikTok, but I'm very much present on YouTube. So find me over there, Topisco Plus. Okay.